Now we'll concentrate on the disease. Our talk will be concerned with the etiopathogenesis, symptomatology, and some interrelationship with in between diseases and treatment aspect. Every time we talk about the two types of the disease, Kamla, Swatantra and Partantra. Here we are talking about the Partantra Kamla after part. When a person intake, consume lot of pittal, ahar, vihar, after getting the panduro, there is rakta and mans dusti leading to Kamla. What is the meaning of the dagda? Oxidation. You know the whole cycle of the bilirubin metabolism, hemoglobin, then heme and globin reutilize, heme converts into iron and porphyrin, iron again reutilized and porphyrin converts into the biliverdin and the bilirubin. This process is important. And after production of the bilirubin, it binds with the plasma protein, especially albumin and also globulin, and circulate throughout the blood, but it is water insoluble, so not present in the urine. This is the reason why in unconjugated hyperbilirubinemia, bilirubin is absent in the urine. After this albumin bilirubin complex reaches to the liver, where it is uptaken by the hepatocyte through the molecule present in the hepatocyte known as ligandin. After entering in the liver cell, there is conjugation of the bilirubin with the glucuronic acid to the help of glucuronyl transferase, and then mono and diacid is produced. Here, the secretion of the bilirubin, conjugated bilirubin, occurs in the bile. Now it is water soluble, so it is present in the urine. After entering in the bile, it goes to the duodenum, then ileum, and then again the metabolism occurs from primary bile acid to secondary bile acid is produced. Bile pigments are produced, stercobilinogen and urobilinogen. Stercobilinogen is created through the stool, give the color of the stool with the ranjan, and then the urobilinogen with the primary and secondary bile acid absorb and circulate in the blood, and again if it is additional enter into the urine. And recirculation occurs to the liver, bile. It is a process going on. The bile is important for the digestion, for the emulsification, and for the absorption of the fat and fat soluble protein. Very important component secreted by the liver. It also helps in the excretion of certain drugs, toxins, and too many things. It also helps in the excretion of the certain things. So also some hormones are secreted through. This is the reason why the Purishdhara in Acharya Susruta finds the relation of the Yakrit with the Purishdhara Kala idea. Another thing you have to know, okay, the color when the biliverdin is accumulated, it gives the color of the harit, and when it converts into the bilirubin gives the color of the yellows. There may be three types of yellowish pigmentation: orange yellow, lemon yellow, and dark orange yellow or dark yellow. What is the significance to note all this? To understand the hemolytic jaundice, hepatocellular jaundice, and cholestatic jaundice idea. Later we'll talk hereafter. The Panduro, since the Kamla occurs, we have to talk about the hemolytic anemia, in which the jaundice is present. For example, in the vitamin B12 deficiency, when megaloblast is produced, when poikilocytosis and anisocytosis are produced, there is abnormal RBC cell which lost its deformable characteristic feature, and it is phagocytosed in the RE cell of the spleen, and then there is hemolysis and anemia with jaundice and splenomegaly occurs with the other features of the vitamin B12 deficiency like neuropathy. The same happens in the folic acid deficiency, my dear. So our approach should be like that. What is the reason of hemolysis? There may be autoimmune hemolysis, there is hemoglobinopathies, there is hydroblastic, there is sickle cell anemia, all where there may be a jaundice. So anemia associated with the jaundice should be thought separately than a direct presentation of the jaundice uh, due to liver and biliary involvement media. Myoglobin is really very important aspect protein which is present in the muscle and help the oxygenation saturation in the muscle. You know the skeletal muscle, the action is very much vigorous action of the muscles, and for that we need the oxygen, and for that we need the intact vyan. Why we need the intact vyan? Because vyan is concerned of the vyan is a dhatu vichhe puchit. Vichhe puchit means if the certain muscles are working, that muscle must get the appropriate amount of the saturation of the oxygen through the blood supply. This is a very good compensatory mechanism happen automatically in the body. So whenever, for example, I am work now, I am talking, so more and more blood will come to the our laryngeal apparatus, our speech apparatus, my dear. When the thing, it is automatic phenomena that the area when need the more blood goes. In, for example, that myoglobin is also important protein which gives the oxygen to the muscle for its action. You have noted already alparag and then reduce man's portion damage to man's dhatu. This is very important, my dear. So whenever the hemoglobin is reduced, myoglobin is reduced, the effect on the skeletal muscles also appear. You can see the muscle mass will be reduced. You have seen a lean and thin person in the very severe anemia when the hemoglobin is less than 4 and 5. You can see the similar feature where mass is lost. So that carceta is present, cachexia is present, asthenia is present, a severe weight loss is present, and because of this portion, because of this oxygenation process of the skeletal muscle, which is being impaired. Heme of Mons is reduced to the bilirubin. When the reduced to the bilirubin, it is now cause of the hyperbilirubinemia, and then the features harit, the netra, some harit, the twak, nakanana. You know, the skin and uh, membrane, mucous membrane becomes pigmented with the bilirubin deposition. The bilirubin deposition occurs in whole body, and when it is more than 20 milligram per 100 ml, then it can cross the blood-brain barrier and pigment the brain parenchyma known as cardiac terrors. So you can understand the severity of the hyperbilirubinemia when it is like bilirubin encephalopathy, when it is like the fulminant liver failure. I don't take it easy, my dear. Simple Kamla may be a cause of the Sangyanas, a sannyas like condition. Simple, but it looks the simple, but on long term it can cause the carcinoma, it can cause the basically failure, it can cause the encephalopathy, too many complications. We are always talking about the Bahupitra, post-Asrit and Shakhasit Kamla. In Bahupitra Kamla, it is understood that the pith is present in the coast, and Shakhasit Kamla means the Alpa pith is present. Now, two nomenclature, Bahupit and Alpa pith, Bahupit in the post-Asrit and Alpa pith in Shakhasit. So, what is the cause of the Bahupit Kamla? We have to talk. Now, prehepatic, hepatocellular jantic, cholestasis, all are there. Because the cholestasis goes toward the obstruction stasis, so it goes directly to the acid. So now what is the remain prehepatic and hepatocellular causes come under the Bahupit Kamla or cholestasis Kamla. But ideal word is Bahupit Kamla. I will give you one example of the triangular Nash syndrome type 1 and type 2. The prehepatic jaundice. It is congenital disorder due to autosomal uh, uh, mutation in the child. It occurs in the neonate. In type 1, there is absolute deficiency of glucuronidase transferase. So life of the child is very low because of phototherapy and something more sophisticated treatment, the life is being increased but not at all. So what happens in the Crigler-Najjar syndrome? There is unconjugated hyperbilirubinemia, my dear. And this unconjugated hyperbilirubinemia may reach to the more than 20 milligram. Now you can understand more than 20 milligram means this is wow. So you think that you know you now you on the clinical work you can understand what is the label of the bilirubin when there is combination of the sartacid and bauxite, when there is combination, as in the hepatocellular diseases, there may be intrahepatic cholestasis, and then scenario is complex type. That also through the ultrasonography and other imaging process, we can understand the combined Bahupit Kamla and Sartacid Kamla. So prehepatic causes include, now severe malaria, certain genetic diseases such as sickle cell, sclerocytosis, thalassemia, pyruvate kinase deficiency, glucose 6-phosphate, and other more than that. Regular Nature syndrome, type 1 and type 2 also should be added. The other congenital causes should be added here. Hepatocellular jaundice can be caused due to acute or chronic hepatitis or virus infections, parasites, and bacteria, hepatotoxicity, cirrhosis, drug-induced hepatitis, and alcoholic liver disease. The hepatitis A, B, C, D, E are very common causes of the viral hepatitis. Cytomegalovirus, Epstein-Barr virus, and other HIV like also may cause the hepatocellular jaundice. In our society, not only in our society, throughout the world, alcohol is a challenge and it is caused very commonly the liver disease. Already I have discussed in my previous lecture. So if you conclude everything, you have the two approach here, pre-hepatic and hepatic, hepatocellular. What is the cause in the pre-hepatic? Hemolysis like condition. Or there is loss of the uptaking because of the absence of the ligandin, as in the Gibson syndrome. And then there may be again unconjugated hyperbilirubinemia because of absence of glucuronidase transferase, as in the certain congenital bilirubin disorders. So now you have to see that the difference. You have to note whether it is unconjugated hyperbilirubinemia or conjugated hyperbilirubinemia or a mix. When it is unconjugated means indirect hyperbilirubinemia, think about the hemolytic. And then here the bilirubin will be absent in the urine, but bile pigment will be present in the urine. Hemoglobin percent will be reduced. Noted the reduced hemoglobin percent, unconjugated hyperbilirubinemia with bilirubin absent in the urine confirm the pre-hepatic causes of jaundice. And then the hepatic causes. Liver function will be abnormal. SGLT and SGPT will be increased. Sometimes alkaline phosphatase will be increased. Serum bilirubin, especially direct conjugated type will be increased and little bit unconjugated will be increased. The indirect bilirubin is about 85% of total bilirubin and only the 15% of bilirubin is direct type. That all normal phenomena and normal laboratory investigation you should know. The normal value of the bilirubin is 0.2 milligram to 0.8 milligram means less than 1 milligram per 100 ml. So now you are very close to understand whether it is prehepatic or hepatic cellular causes. Now in the treatment, Acharya Charak mentions that Tiktaras Pradhan Mridu Virachan. Why the Mridu Virachan? Because already we have talked about the after Pandu. Whenever the disease occurs, whether it is Punaravartak Jwar or it is Kamla or any Pratanta Vyadi, and already the Sodhan is done in previous disease occurrence, and then the Mridu Virachan occurs. You can also note in the reference with the Amlapit Purbam, Baman Karbam, Maman Karmam, Pasat, Mridu Virachan. So whenever a second procedure is done, the second procedure must be Mridu because there may chance of the after there chance of the circulatory failure, there may be chance of the danger to the life. This is the reason why Achar mentions here Mridu Virachan, my dear. While in the Vaman, Krishna Vaman Virachan, in the Pandu, Krishna Vaman Virachan are mentioned. But in Kamla, no, Mridu Virachan is meant. That logic you should understand. What Tiktaras Hiranyapatasaurus is good, Kumarisaurus is good, the Sattar is good, Hypatica is good, Gravity is good, you see. So something is there which help you not only in the viration, also to work on the Kamla, also to work on the active. This is the specific approach of Acharya. Tiktaras is good for the Rakta, Tiktaras is good for the Pitta, Tiktaras is good for the active, very good for the active, my dear. So you can understand what is the reason behind selection of the Tiktaras Pradhan Mritu and then after the Shodan, the Samanij. What is Lakshikari? Acharya in one reference mentions the Prata Kalinio in that he is basically recommends about the Nimbasaurus, Amritasaurus, Triflasaurus with Madhu. Prata Kalin, my dear. And especially in my his clinical practice and experience, I love the use of Erandapathasaurus with Nimbapathasaurus or Marisaurus or Amplitasaurus. Because Erandapathasaurus is a little bit Ushna and patient. Sometimes there may be a fear of the Parakipit also, and that time we have to add the Vasasaurus and Taurisaurus with Erandapathasaurus to prevent any danger, any side effect related to the Parakipit. अमृता पटोल निम्ब दारवी हरिद्रा अमलकी विडंग असदादि गण किरात तिक्त पुरोहितक सरपुंखा दाड़ीम हरितक lot of tikta dravya madhura dravya are present which help in the dracha is very good. Arabhat is very good. You can understand the a lot of drug is effective. So Arabhardhani is also indicated and even the you can use the Mahasudarshan because it contains the Kiratic light. You can use the Tikta Kasai, Panchatikta Kasai, Mahatikta Kasai, Manjishtagi Kasai, Asnadi Kasai. You'll be surprised to note in Kushtaroga Adhikara Chachara mentions in too many places Kamla Halimak in the Falsafah. Kamla Halimak are mentioned also in the Jwar, Raktapittu, Gulmu, but very commonly in Grahadi, very commonly in the Grahadi. So what is the falsity of a specific drug like Kiratik Tadichu mentioned in the Grahadi, Pittaj Grahadi, in that the falsity Kamla is mentioned. Trishranadi Grit mentioned in the cause and Kamla is mentioned. Trishranadi Grit mentioned in the Vatik Hridrog, Charak 26, Kamla Halimak is mentioned. Halimak is mentioned there. We'll talk later. So please read the you with the falsity and note what the diseases are mentioned in this specific combination. And that you can use also in that condition. Now next is the Sakha Siddhanta. Simply, it's a post-hepatic, also the obstructive jaundice, cholestasis. Cholestasis, simply. You know the biliary tree. Now something is wrong in the biliary tree. There is obstruction, there is autoimmune phenomena. I have seen one case of the child who came to our surgeon with an acute abdomen. That time when I was in the UG, it was not so easy for the sonography and all. And sir opened the abdomen and open the bile duct and find the ascaris in the common bile duct, my dear. So ascaris also may be a cause of the surface system. This is the reason why the krimi is also considered. I have already told you earlier in my previous lecture the importance of the krimi and the importance of krimi that is ascaris.